if you have a PsyD, if you have a doctorate, your potential to earn is basically not unlimited, but you have a very high potential to earn. You can make upwards of 200K if you really wanted to. Okay guys, so now we're going to be talking about what does a clinical psychologist actually do during their career or during their day job. What are their duties, what are their tasks, and how do you know if you're a good fit for this sort of job? Hello everyone, Happy New Year, and in today's video we're going to be talking about what is a clinical psychologist and what are the career prospects, job prospects, things like that for this sort of occupation. If you guys did not know, this is the exact position that I'm going to be going into in my career. This is the degree that I want to get, or one of these degrees is the one that I want to get. And so straight away, I want to talk about how to become one, because I think for a lot of people, this is obviously an important thing. Like, what kind of education do you need? And for psychologists specifically, you do need some amount of schooling. Typically for a psychologist, you need either a PsyD or a PhD. Now, there are some exceptions to this, which I'll talk about in a minute. But you either need a PsyD, which is going to be 4 to 5 years, or a PhD, which is 5 to 6 years, or even longer in some cases. So these are doctorate degrees. Obviously, these are long degrees. But if this is what you want to do, this is a really, really solid career choice, and especially if it's gonna like make you fulfilled, if you have a knack to sort of help people, to understand people. This is what really matters over how long you're going to be in school for. That's my opinion. Especially if you enjoy school and if you enjoy being educated, enjoy learning more, because knowledge is power, right? So as it says here, a master's degree may be sufficient for some realms, specifically school and industrial organizational positions, which I do have a video on this field as well if you guys are interested in IO psychology. But for every other, like counseling, clinical, stuff like that, you do need a doctoral degree. And you also need a license, which you'll get after you get your degree. And it shouldn't take too long, but one thing about that is you do need one for whichever state you're practicing in. So if you get your degree in one state and then, you want to move to another, you need to get your license in that state that you're moving to. So that's something to keep in mind. Becoming a psychologist is not something you're going to do very, very quickly because of the amount of schooling and education and, time and effort and money that you have to put into it. But, again, if this is what you want to do, this is a job that is going to fulfill you, and it's going to pay pretty well as well. Not that pay is the most important thing, but it is something to consider at least somewhat. And something cool about psychologists working is that you can have your own practice. So those in private practice often work evenings and weekends to accommodate clients. The cool thing about private practice as well is you can make more or less. You can work more or less, and you can work around your own schedule. So you can see the average median pay for a clinical psychologist is $81,000 per year as of 2021, which is now a couple years ago because it's 2023. That's kind of crazy. But this has been slowly rising. I've been watching it over the last couple of years. It used to be like 80K. Now it's going up. It's probably like 82K. Also inflation and stuff like that. But yeah, so if you're working in private practice, basically what that means is you're creating your own business, and you're probably gonna have some kind of a specialization in something, or you're just a general psychologist. So if you're a general psychologist, you're basically saying, okay, I'll meet children, adults, old people. I'll meet anyone with any sort of disorder. However, if you do specialize, you can treat people with, substance abuse, specifically depression or anxiety, mental illness specifically. You can do like family therapy, you can do relationship therapy, right? So, I think that's very useful if you want to specialize and if you want to create, if you don't want to work for someone, because you can set your own time. So you can work like 20, 30 hours a week instead of 40, or you can work 50, 60. Kind of just depends how passionate you are. It depends what you want to do for who those that you're helping. How passionate are you? How much do you want to work? But other stuff about this, it's growing just about as fast as average. Now, let's talk about how to get into graduate school. So, because that's kind of the process that I'm going through currently. So again, you're probably going to need a doctorate. You might get a master's if you're going into one of the other fields we talked about at the beginning. But typically, you're going to need a GPA of above 3. And in many cases, a 3.5 will help you out tremendously as well. And yeah, so that's necessary. Okay guys, so now we're going to be talking about what does a clinical psychologist actually do during their career or during their day job. What are their duties, what are their tasks, and how do you know if you're a good fit for this sort of job? Now, there are actually differences in a psychologist versus a therapist. So what is the difference between these different things? So specifically, what a psychologist can do that other therapists cannot do is they can actually diagnose mental illnesses and they can screen for mental illnesses, right? They can't prescribe medication, at least not yet. However, I have talked to an expert in the field, and they say that there might be a chance that someone with a PsyD might be able to prescribe medication in the future. I'm particularly interested in this for psychedelics, but for as of now, you cannot prescribe medication unless you have a medical degree, which would make you a psychiatrist. And that's really what they specialize in. But for a PsyD, your primary function outside of diagnosing and screening for mental illness is going to be helping others improve essentially their overall well-being. Again, there are a variety of specializations you can choose to have. So substance addiction might be a little deeper. You might have to relate to your patients a little bit on a deeper level. Relationship, family, just general therapy, specifically depression, anxiety. But all of these things share, you're still helping these people in the same way, and you're trying to understand them and help allow them understand themselves on a deeper level that will ultimately improve different aspects of their well-being. And that might sound very broad, different aspects of their well-being. What does that mean? Well, it could mean, something specifically like getting a better grade in school or just overall feeling happier. Really, it depends on what they want to get out of the therapy session or out of you as the clinical psychologist, right? So really, you serve as a sort of tool to better them, or almost as like a mirror to better themselves, that they can see themselves through more clearly, because sometimes it's very easy to see yourself in a foggy sort of way or in an unclear way. And if you could serve as a mirror that allows your patient to see themselves crystal clear, that's often the most helpful thing ever. I speak from experience, going to a therapy session a few times, and yeah, so you can see some words here. You can see assessment, cognitive psychopathology, family, rural, all sorts of stuff, psychotherapy, and there's different types of psychotherapy, stuff like that you can do. But that's really the function or the job that you're going to be serving as a clinical psychologist. Hopefully this makes sense, guys. Let's see what else we have here. Alright guys, so lastly we're going to be talking about pay when it comes to different types of psychologists. Now you have to understand that there is a median number, but this number is not going to necessarily apply or be the exact same number that you might get whenever you first get a job, especially when you first get a job. But also specifically what you want to specialize in, and also what sector you work in, what state you work in. So those are the things we're going to be looking at now. You can skip ahead if you like. But basically the highest paid type of psychologist is one that I've already covered, which is industrial organizational psychologist. And this is also one of the least employed types of psychologists, which might be why they get paid so much, because there's not really an abundance of them currently. Now you can see psychologist all other, it says 102,000. But when we look at clinical and counseling psychologists, they get paid a little bit less. And this might be for a variety of reasons. School psychologists get paid least. And here are the different sectors. So you can see sectors by government, hospitals, different things like this. Government gets paid most. But here you can see the lowest 10% earned about 50K, and the highest 10% earned about 133K. So what this means is basically if you have a PsyD, if you have a doctorate, your potential to earn is basically not unlimited, but you have a very high potential to earn. You can make upwards of 200K if you really wanted to. Now, at some point, do you really need that amount of money? Probably not, unless you just want to have it. But it is possible in this field to earn a lot of money, especially, right, if you do your research and you figure out, okay, what specialization, right, if I'm thinking substance abuse, right, okay, what place in the United States has a history or a current problem of substance abuse? And then you go there, you make a business, and then you advertise it everywhere, and people come to your business, and your business thrives, right? And you can make easily 250K a year just because you picked the right place at the right time, and people find your service extremely useful, and you work a lot of hours a week, and you love your job. However, at the same time, if you don't think about any of that and you pick a specialization that's not needed at all, you could make, like here, 50K. And now this is not necessarily private practice. Obviously people are going to be willing to pay you low if you're going to be willing to take that. And also this depends on the different geographic locations within the United States that you're going to work. But let's actually look at that, right? So here we can see different things. I'm going to click on clinical and counseling psychologists. Now, if we scroll up here, this actually says 99K. So I don't know why these two numbers are different, but maybe this, oh, here it is. Here's the actual median. So, oh, this is the mean. The median is 82K. So the mean is the actual average. That means the people that earn more are skewing this number higher. But the actual median, meaning the 50th percentile, is $82,000. And here you can see the people, like I said, these people can earn up to a lot. Down here, these might be, you might start out like 60K, especially if you have like a PsyD. You know, your first year working, you're going to maybe not have 100K, but that's completely fine. You're going to quickly go up. And here, what I really want to show you guys is how much the earnings per year really can vary depending on where you live. So obviously California, if you do live in California, the cost of living there is extremely high. So naturally the pay is going to also be higher. So this is going to be the highest, 122K. And then here you can see actually the top 5. But if you're a little bit smarter and maybe a little bit more frugal, or, you know, thinking a little bit forward with your money, and how you're going to save and invest, you might consider living in a place where the cost of living is not too high, but you're also paid a good amount, perhaps like Illinois, where you're getting paid an average annual mean of 100K, and the cost of living might not be as bad as that of like California. So, you know, this is something to consider. Also, don't just move somewhere because you're going to make more money there, unless you absolutely need to, obviously. But try to pick somewhere, but you don't really have to worry about money with this job, because, you know, you're needed. You're going to be needed for probably forever. I don't believe that AI could replace this job personally. I just think that there's many people that would feel like they're being scammed, or like it's not real, like not a real therapy session, if they had a session with an AI. But that's a bit of a tangent that I've been thinking about a little bit on my own. Now here you can see that some places will pay. Also, the darker means that there's more employed. So you might also be a little bit smart to move somewhere where there's not as many people working, but you're also getting paid a good amount. And that's what location quotient means. The higher the location quotient, the more clinical or counseling psychologists that currently work there, or as of May 2021. And then here's some more stuff, and here's the actual pay, right? And you can see here, the dark blue ones are the areas you're going to get paid most, and the lighter ones are the ones you're going to get paid least. So, you guys, this is really valuable information if you want to learn more about not just this job, but any job. Again, pay is not the most important thing at all. It's probably one of the least important things in terms of, you know, what do you want to do for a career, for a job? But it is a factor, and it's something that I think deserves to be talked about here. Hopefully this section is useful. Remember to use bls.gov. It's a very valuable resource, and I'll see you guys in the next video. Please leave a comment. Let me know what you guys would like to see next. I'll make any type of video related to psychology, cognitive science, anything like that. And peace, guys. Have a good new year.